The questions are rolling in. There is a question regarding the case study of the 63-year-old patient that Dr. Ajith talked about. The question is this: did this patient have any history of mild cognitive impairment or neurodegeneration? And following from that, basically, does the medical history predispose a person to an infection that later flares into a neurological response?
No, he was a gentleman with diabetes. Otherwise, he was pre-morbidly well. He didn't have, meaning he's a diabetic, but was pre-morbidly well prior to the 3 days of onset of the coronavirus infection. That he was probably because of chronic diabetes, he was slightly immunocompromised, with which he went on to develop this. Like in my first slide, I actually put across like the subclassification in which we have actually found a few patients who come in with meaning what you call severe cognitive impairments reported after COVID infection. But when we actually go through the history, like they might be having very mild disconnection problems right from beginning, like which may have been underreported by the family members. So I think in those kind of cases, all your functional connectivity networks, etc., could be of great help in characterizing it. I think it's going to come up.
Thank you, Dr. Ajith. There is another question following up from that, which is a more futuristic one. Since COVID is known to induce changes in the brain, this could be implicated at the neuronal level as increased oxidative stress or protein aggregation. Do you, Dr. Ajith, think such a scenario could predispose the person to develop a neurodegenerative phenotype in the future?
I think it's a far-fetched theory right now, but what is known from some of the autopsy studies is that, like in patients with, again, this goes back to the basics of pathogenesis of coronavirus and neurological involvement. And based on a lot of these autopsy series which I've come across, they have been able to demonstrate in some cases, like as we all know, one of the commonest symptoms reported is anosmia or loss of smell. So like that could be due to a local invasion, not just a nasal involvement. There could be involvement of the olfactory bulb and the central nasal pathways as well, olfactory pathways as well. And similarly, there have been demonstration of a lot of thrombi, microthrombi in the brain. Very less demonstration of virus per se, but neurotropism as well as a hyperinflammatory response, like just what happens in the lungs and thrombosis, has been demonstrated. I'm not particularly sure whether amyloidosis or anything, but amyloidosis is just a